I am a physical therapist. I'm the owner of PhysioX out in Needham. And I was a personal trainer at Equinox in Chestnut Hill back probably 10 years ago, like we talked about earlier. And this is my associate, Dr. Adrian. Adrian will be leading the second presentation. Today we'll be talking more about the lower extremity. But then Adrian, I want you to go ahead and introduce yourself.
Yeah. So my name's Adrian. I've been at PhysioX now for 5 months, 5 or 6 months around there, started in the summer. But before that, I'm an athletic trainer and worked in professional baseball for 5 years before going on and taking on my physical therapy degree from Tufts University. So it's a little bit of background on me, and yeah, also a physical therapist, enjoy working with everyone, so nice to meet you guys.
All right. So today we're going to talk about the nervous system and how it relates to the lower body and how do we look at the body from that lens. So what does that mean, the nervous system? Well, when we move around, everything is happening subconsciously. We're not really thinking about the way we move. And that's really what I mean by the nervous system. It's just things are happening in the subconscious mind. Now, the way I got into this space was actually through my mother. So my mother actually had chronic back pain, and she's an immigrant from China, sacrificed everything for me to go to school, and through that process of working in like a digital factory, she developed this chronic back issue. And so I graduated physical therapy school, and I said, you know what? I'm gonna help her because I was a personal trainer and now I'm a physical therapist. So I gave her, like, you name it. Gave her the transverse ab stuff, gave her like the back stretches, the hip stretches, the side leg raises, all the stuff I learned in school, and she didn't feel any better. So that was kind of a tough time for me because I felt like, you know, she sacrificed everything for me to get this degree in order to help people like her, and it failed. So I'm like, what's the whole point of doing this whole thing if I can't even help my mother? And so that led me to learn from other experts. Now, my rationale is, hey, look, if all the stuff I learned from the US had failed, let me learn from experts outside of the system. Let me learn from people from the UK, from Ireland, from Canada, and let's just see how they approach the body. And that's how I really developed this nervous system-based approach to treating injuries. And from there, I started posting some stuff around 2020 on TikTok and Instagram. I used like Dr. J as my name, and it started to blow up a little bit more. People like caught on to the message, and I started seeing clients all virtually. And I saw clients from Australia, from the Middle East, from Germany, West Virginia. It's probably the most random out of all of those. So, and we got some people, some amazing results, people who are just like my mother, who's been dealing with these chronic, persistent, nagging issues, and it was unbelievable. So in 2022, we decided to open up a brick and mortar practice. We want to build a team. We hired Adrian, we hired our front desk staff, Rebecca, who's not here with us today, and we expanded to treating other musculoskeletal injuries in addition to low back pain. And today we'll be sharing a bit of our secrets of how we were able to be successful in dealing with these more chronic issues where other people had failed. Okay?
We're almost there.
Oh, we're almost there? Oh, we're doing it over there? Oh, we're doing it over there?
We're going to move this so that we can just do it right up here. So
Oh, I like it over
everyone
there.
else does not have to move.
All right, all
And
right.
then you don't have to move your camera. That's all.
That's all I care about. It's the content right there. All right, where was I?
Content game.
Exactly. All right, so let's talk a little bit about the overarching philosophy of how it all works. Here's the thing, when you have an acute injury, like if you twist your ankle yesterday or like 2 days ago and it's all swollen, you go to a traditional PT and more or less you're gonna get some good results. They'll get the swelling down, they'll put the stem on you, whatever it is. Next couple of days, you're pretty good. But if you have an injury that's on and off for a couple of years, or an injury that came on out of nowhere, like your hip just woke up one day and you're like, yo, what's the deal? And you can't squat properly, or you're like hip shifting your squat, you go to a traditional PT, they're not really gonna know what to do. But the issue is, that's the majority of people that we see are people with more nagging, chronic type issues. That's probably the people that you guys are probably seeing right now in the gym. You guys are working out, but they are dealing with some kind of nagging, persistent issue that's like you guys are modifying, but it just kind of comes on, it goes away, and it comes on again. So this is the reason why this keeps happening and what we can do about it. So we'll give an example of someone with back pain, like present day back pain. let's say 10 years ago, they're running on a trail, they're running and then twisted their ankle. And what happens in that point, the nervous system hosts a meeting. Now the nervous system have two goals. It's to keep you upright and get you surviving, get you from point A to point B, however way it can. So the nervous system hosts a meeting kind of like this. Say you're the ankle, you're the hip, you're the head, and you're the knee or whatever, right? And it'll say, hey, team, ankle is in trouble. We need to offload the ankle. So hip, I want you to go hike up a little bit. And it'll go like that. And now you're all crooked, right? And you know what? That doesn't look right. Shoulders and rib cage, I want you to rotate the other direction. So you're like, okay. Still don't look right. Head, I want you to tip back this way. Okay, we're good. And now this is how someone limp. That's the pattern you start to adapt because of the nervous system need to survive. Now what happens next? Over the next couple of days, couple of weeks, the ankle feels better, and you're starting to walk normal, but you're probably still holding on to maybe a 5% of that same limp, unbeknownst to you. And you're gonna carry that limp with you with everything that you do. Like if you squat, you might not load that same leg the same way. You might go, whoop, a little bit over to the left. When you run, you're not gonna load that same leg the same way. So you might go, whoop, a little bit over to the left as you go. And then one day, your hips start hurting because you keep squatting, you keep loading it to the left side, and they keep getting hurt. The nervous system hosts another meeting, and they say, yo, hip, what's going on? The hip goes, I'm just tired of doing the work of that ankle for the last 3 years. I need some help. So the nervous system goes ahead and looks around and goes, low back, what you doing? Low back goes like, yo, I'm chilling, like, what's up? And he goes, can you help out? And the back goes, yeah, I guess I can do something. And then after a couple while, this person comes in for low back pain. And what they do, they give you a little massage, work on the core, do a little hip stuff, some clamshells. Back feels a bit better, comes out. Next thing you know, a couple weeks later, it comes back. And that's the story that happens all the time. And you guys can probably relate to this to some point in your own body or just know someone who's dealing with these type of issues. All right? So those are the population of people that we see, the people who just kind of been left behind by the system. They tried the PT, oh, it didn't work, just have to live with it. But we don't think that's the case for majority of people. We think that, hey, look, if we can look past the symptoms and really dive into the origin of why all the compensations start to happen and fix at the root, then we can really get ahead of the issue. So we're going to talk about the foot today. And why that's important? Because when the foot touches the ground, everything starts to change. What you guys learn in textbooks, what we learn in school, is what we call open chain biomechanics, which is this is extension, this is flexion, this is extension, right? It's all open chain. But once you put the foot on the ground, everything changes. It's called closed chain now. And it's crazy that we don't think about movement in a closed chain fashion for the lower extremity. So, when the foot changes shape, and it will, if you were limping, at some point you might not place all the weight on your full foot. You might place a little bit more weight on the outside. And guess what happens to my body? If I put more weight on the outside of my right foot, you see how my body has to change and shift in order for me to stay upright? Now I can massage the hell out of my back, my hip, I can do all that stuff, but we're not changing that foot pressure. It's really hard to get to the end and solve this issue, right? Okay, so now I want everyone to just stand up and I want you guys to just experience your feet. And y'all can take off your shoes.
You said take them off or not?
Yeah, take them off.
This is the same stuff we did in the PhysioX meeting.
Damn, you were there?
I was there.
Yo, you liked it?
What? I liked it. Well,
Damn, forget it. Don't tell me. Don't tell me. It's similar. Same but different.
don't ruin it.
Don't ruin it, man. Yo, what happened?
Experienced a lot of single foot.
Huh? A puddle? Damn, bro, you'd be looking out for those puddles.
Should have been home.
Damn.
Wonder why they go home.
What was it? Is it an Achilles or what is it?
Biomalleable fracture with the torn ligament.
All right, cool. I tore my Achilles one time. You good. All right, so we're gonna go through a functional screen. So everyone go ahead and just touch your toes. Okay, stay down there. All right, and you can come on up. Good. Now I just want you guys to let me know, where do you feel the pressure in your feet? Is it towards the heels, towards the front of the feet? Heels, balls, heels, okay, all right. Mac, I think we're good. We're good. Yeah, we're good, we're good. Yeah. Yeah. We're good. All right, you can put your hands on your hips and go ahead and just arch back. Yo, you okay? Yeah. You seem. Oh, okay. All right, arch back. Okay, come back and tell me where the foot pressure is for you guys. Who's like forefoot, front of the foot? Who's like heel? Forefoot. Who's got heel? No. Oh, you got heel? Okay. All right. Now I want you guys to go ahead and reach one hand down the side and come on up. And who feels the weight on the left foot or the right foot? When you go down to the left. Left. Everyone just goes to the left. Who feel on the left foot? Who feel on the right foot? Okay, cool. Now let's go reach down to the right. And come back up. Who feels it on the right foot? Who feels on the left foot? Okay. Who feels on the same foot no matter which side they reach? Okay, cool. Because you will see some presentations in which someone just loads the same foot no matter if they go this way or this way. So that's a pattern that you can tease out and figure out, okay, what's going on here? Now we're going to do a rotation. Everyone rotate to the left. All right. Good, and come back. Good. Where's the weight going? Towards the left or towards the right for some of you guys? Right. Anyone got left? All right. Everyone rotate towards the left. All right, and come back. Left, right.
Left.
When you rotate to the left, you feel left.
No, when we rotate right, I feel left.
Okay, when you rotate to the right, you feel. My left and right is bad. I don't know why I'm even asking you guys. All right. All right, so this is what I'm looking for during like an assessment of these type of motion. If I'm going down, I'm reaching down here, I expect a lot of the weight to start shifting towards the back side of the body, so towards the heel. So if your weight is on the forefoot, you're kind of falling over, right? Your nervous system's not going to let you fall over. So if someone's have their weight towards the forefoot as they're reaching down, I'm thinking they're probably going to have to use a lot more effort to go ahead and go down. So if I can bring this center of mass back towards the heel, this person might just end up going down further to touch their toes. Just one little example. If I'm having you arch backwards, I expect a lot of weight to go towards the forefoot. Okay? Now if I go reach down to one side here, I actually expect some weight to go out to the opposite side to free up some space. So for example, let's go do like the left side. If everyone go down to the left and put the weight on the left, kind of notice how that feel. Come back. Now if you go down to the left and shift your weight to the right, and just notice how that feel. You kind of open up some more space for your lumbar spine, your hips to move, right? Now instead of the ratio being, all in the back, now it's being shared among the hips here, the obliques here, and the spine doesn't have to really go into that exaggerated shape. Same thing for the opposite side. If you go down, reach down to the right, I expect some weight to go towards the left. And when it doesn't do that, I'm asking why doesn't it do that? Okay, come on up. And if you go rotate towards the left, I expect weight to go towards the left side, actually. Now, if you can't go towards the left side, your weight on the right side, I'm thinking, is there something we need to think about on the right foot or the left foot? And then rotate to the right, I expect a lot of weight to go towards the right. Okay. Okay, so these are just general kind of rules. No one has to abide to these rules, but it gives me a lot of clues as to what's going on. Now we're going to get into the foot. If I rotate left and right, you can see my feet here, and you can experience it for yourself. One is going to supinate, one is going to pronate. Arch up, arch down. So if I rotate to the right, my right foot will start creating an arch. My left foot will start creating a flattening shape. If I rotate to the left, just the opposite start to happen. My right foot will go flat, my left foot will go arch. Okay? Now what happens if one of the foot cannot manage one of these shapes? If I need to rotate to the right, and I need my left foot to go flat, but it doesn't, can you see that we're not going to be able to rotate as cleanly towards that side? Because we're missing motion in that foot. Okay? So, today, closed chain mechanics, we're going to talk about just getting this foot to experience two shapes. Supination, pronation. Number one, we want to experience pronation. Why pronation? Because that is how we absorb force onto the ground. If I bring my shin over on top of my foot, I need this bone to rotate down and these bones to separate. And when I do this, we're absorbing the force from the body. And naturally, just coupled motion that should happen. This bone should theoretically kind of rotate inwards a little bit, and it's going to cause the femur bone to rotate inwards a little bit, and it's going to cause this pelvis to open up. So here's what I mean. I'm going to take off my socks so y'all can see. So if I go to the left side. If I bring my knee forward, naturally my tibia internally rotates and my foot flattens out. That will bring my femur inward. It'll flatten out. But watch what happens to the pelvis. It starts to give us that little anterior pelvic tilt. If we want to go talk deeper into mechanics, we have a nutation of the sacrum, which allows us to go into what we call a hinge. Now we're getting into exercises. So we are lacking this pronation moment in the foot. How do we get into a hinge? It might be a little more difficult. And without that, we might not be able to access that glute nearly as well as we should. So if my foot goes arch, it's coupled with everything the opposite. Everything will twist out. It will go this way, it will go this way. It will make my pelvis do this. It's coupled in that way. Now if I go forward and my foot doesn't go flat, look what happened. I'm just shoving forward, right? And if I want to hinge, it's going to be tough. I'm going to round my back to get there. All because could be coming from this closed chain mechanics of the foot. So we're going to work on experiencing first pronation. Now, most of us who think we have flat foot don't really have flat. What's this bone? Most people actually just have a dumped over foot like this. A flattening is a dissociation between these bones. Okay? So we're going to start with one leg in front, one foot in front. Okay? You're going to stay heavy on your heel. That's important because if your heel comes off, you're going to lose this motion at the calcaneus. You're going to shift your knee forward slowly while you stay heavy on that heel. And just notice where your knee is going. Naturally, we want to experience that knee just coming in towards that big toe a bit. Okay? Who got that? Pretty good there? You got some knee pain going on there?
No, just feeling where my knee was.
Okay, all right. Now, this is huge because this is a natural movement pattern from the nervous system that should happen in natural life. But in the gym, we might be coaching our clients to go and spread the knees out, spread the floor, and that goes against what naturally should happen kinematically. So we go forward this way, allow the pelvis to relax. So let it kind of drop down. We call that the anterior pelvic tilt. All right, and bring your chest forward, right here, okay? And as you stay here, just chill. And just notice how this feel. Just like which muscle is turning on. Do people feel some quad?
The core.
The core is turning on, okay.
Quads.
Quads, which part?
Lateralis.
Lateralis? Anyone feel anything else from the quad? Quad, glutes. Glutes, perfect, good. So if you're feeling the glute in this shape, you're getting all the mechanics right. Lateral usually means we're probably not getting that true pronation because we should be feeling more medial quad right here, okay? We can check the other side and just see what the difference is. Other way. You're gonna bring the heel down, slowly bring the weight forward, and allow that knee to cave in. Okay. And how's this for you on this side? You feel the medial, right? So on one side you feel the medial, on the other side you don't feel the medial. That means when you squat, when you lunge, when you run, you're gonna have great kinematics on that right side, but that left side is not gonna have the same. So you might end up having some lateral issues maybe on that left. I'm just guessing, you might not. But that is something I'm predicting could happen just based on what I'm experiencing. Right. So if you have an ACL tear, LCL tear, okay. But you see how it starts to make sense based on foot pressures, based on these mechanics of the foot, what's actually happening to your body. So if you're looking at your knee, but you're not looking at what's going on here, you may be missing a big part of that puzzle. Okay? So this is just something I want you to experience. Now we're going to go into one of my favorite back rehab exercises. This is something I personally use for my mother, for a lot of people. And the whole premise of this is we're trying to take a lot of the work out of the lumbar spine, the back, and shift all the focus into the leg. And we do that by slouching. A lot of people with back pain thinks they have to sit up tall, arch their back, but all that does is clench your lumbar spine. It makes no sense. If you're trying to relax your spine, why are you trying to force yourself up tall? If you're going to be up tall, it should feel natural. And for that to feel natural, well, we need to look at the foot. But now let's talk about the slouch. If I take this weight forward like this, all I want to do is this. Put my fingertips here. I take an exhale so my ribs come down. And I keep my weight. I keep that pronation happening. And I just get all the way down here and let my head drop. Good. And Adrian, you can kind of like fix some people up. So if you have all the weight on your back leg, you're not doing it right. So bring some more weight towards the front side. Bend your knee a little bit. As you're staying down there, who's feeling some work in their glutes working? Glutes, glutes, glutes. Perfect. Perfect. Now we're going to come up. And when you come up, that's too fast, too fast. Go back down, go back down. When you come up, don't move your knee. Just come up, but leave your knee alone.
Yep.
And just stay slouching through your back. Stay slouch, stay slouch, stay slouch, stay slouch, stay slouch. Good, good, good. And come on up. Good. So I'm going to demonstrate a little bit, show you guys the upward portion. If I bring all my weight forward and I go down, I'm going to open up this glute right here. So it's going to work. It's going to have no choice but to work because you're putting it into a position in which those muscles are at a maximum length. And it has to work. It's like if I put my bicep down here with a weight, I don't got to tell my bicep to work. It's just going to do it. Same thing we're trying to accomplish here for the glute, but it's just a different structure. It's a pelvis with more ranges of motion, different planes. And as we go down here, as we come back up, don't move the knee, stay slouch, and push through the forefoot. So when you do it this way, you're not using any lumbar extensors. Most people would want to do this. They want to go. So now the ratio of work is 80% back, maybe that's 20% leg. You can get up and down very easy without actually using your legs. We just want to shift the ratio around. So here we go down, and one extra thing I want to talk about is tipping over. So pretend like you're about to go on a somersault. So I'm going like that. You see what just happened here? It's like I'm about to fall on my face. And now this muscle is really going to start working. Kind of like a fishing rod, you know, like that. Tipping over, somersault. So we're going to do that again with those extra cues. Bring your weight forward. And when you bring your weight forward, let that back heel come off. So most of the weight is, y'all can make some room. Y'all can like move some stuff around.
Yeah. You can go a little more
Y'all like
forward.
so bunched up.
Yeah.
All right. Up here. Go ahead, slouch over.
Yeah.
Stay down
Relax
there. I
the
want you
head,
guys to think
everything.
about that tipping over motion, like you're about to fall on your face. And when you do that, who feels the glutes kicking on that side? Perfect. Keep that glute on. Go ahead and slowly push through your forefoot. Slowly come up without
This is the
extending
free
your
going
back. Stay slouched the whole time.
Keep this bent.
Go, 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 go. Boom. Nice. Who felt good amount of glutes work in there? So that's a really nice way. You put that as a warm-up for people, especially if your clients have back issues. A lot of times they're just not really using their legs. They'll use their back to do a lot of work. And this will neurologically redesign how that ratio is going to play out when they go up and down. We're going to do a couple reps on the left side just to even you guys out. Then we're going to go do some other moves. Go ahead. Bring the knee forward, heavy on the heel. Chest up first. Yep. From here, fingertips down. Exhale, reach.
Yeah, shift your weight forward.
And just let your head down. Then we get to the bottom. Somersault over, tipping over. So you're about to fall on your face, put your head down. And at this point, you're feeling for that same sensation you felt on the other side, which is the glute getting loaded. And then you slowly push through your forefoot to stand back up. Stay slouched over the whole time. Good. And we'll do 2 more reps like that.
Yeah, you want to bring
Down.
your weight over, even before you go down, so come back up.
Yeah,
Yeah, keep this straight.
you remember this one.
So stand up tall, keep this straight.
Yeah, you
Now
remember.
start bringing your weight
Exactly.
forward. So now you can experience like that flattening of the foot, and now the fingertips.
Oh, yeah, yeah.
And then this one can come up, like you can just be,
And come back up.
yep, and then push
Say it
through
again?
here, keep the knee in the same position, yeah.
So it's not similar to a Jefferson curl because we're really looking at single leg mechanics. Jefferson curls, it's not quite the same
That
because
way
Jefferson
can
curls you
access
still
that
have a
whole
bit of a
hamstring
hinge
and
going.
glutes. Yeah.
I mean, you know what? Yes, it is
Yeah.
similar to Jefferson curl. Now I'm putting my thought process in it. Yes, it's very similar to Jefferson curl, but I wouldn't load this one though. I would just have body weight because most people have some kind of nagging persistent pain. You don't gotta load them. You gotta just make sure the ratios are working well, and then you can load them afterwards. But a lot of people will actually feel the soleus work when they're doing this, and that's huge. If you don't have really strong soleus over here, it's hard to stabilize down here and come back up. So people back would literally be in trouble because of weakness here. And this is one of my favorite exercises because it just addresses so many things all at the same time. Number 2, one of my favorite exercises for people with back issues is just a stomach stretch. Okay? So it's the same thing, but the opposite direction. I bring my knee forward, my foot collapses in, my knee comes in a little bit here. And this time, I'm thinking about my nipple line going up. So I'm going kind of reaching up in the air, and my rib cage is doing this, is rotating up. But here's the cheats that most people do. They will go whoop, they will just kind of compress into their spine. Don't do that, so keep your rib cage in front. Reach, 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 up, 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 up. And what you're looking for is a stretch in your stomach. Who feels a stretch in their stomach? Who feels a compression in their spine? If you feel a compression in your spine, most likely you're probably not lifting your nipple line up, so you're compressing. So keep your weight forward right here. And think about going up first. Don't think about going back. Up first, and then you might just go back just a tiny bit. Girl, you're real sore. You just like, you don't want to move at all. All right. Is that cool with people there? We're going to do a little bit on the other side. We'll do a couple more so you guys can be a little bit loose by the time we're done here. Left leg. Bring that knee forward. Yeah. And just reach up. Up, 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 up. Get that stomach stretch, and you can go back just a little bit as long as you're getting more of that movement from here. And you can exhale. And we'll do it again.
How long do you have them like hold that for usually?
Sorry?
How long do you have them hold that for
Depends on the person. Yeah, again, I say quality over quantity. If they can hold this for like 2 seconds, and come back, they're good. You don't have to stay here unless your work requires it. Like if you're someone that needs to constantly do this, volleyball, I'm a volleyball player, or like just putting stuff on a plane, then I might have them actually be here and actually do a much longer duration. Okay? So, oh, you have a question?
Sorry, after your,
No, please.
so when I reached, I felt the compression in my spine. Once I felt it, on my pelvic, felt
Post?
in neutral. Is that what you're trying to do?
No.
Get neutral?
So come over here. So with this move, we're not trying to posterior tilt the pelvis. We're actually trying to do the opposite. We're trying to anterior tilt the pelvis because with pronation, it coupled with anterior pelvic tilt, not posterior. So if you're feeling posterior, that's why you think you're actually compressing into your spine versus if you have anterior, now you can open up the belly. So which side is it?
Left side.
Left side. So if you go ahead and bring this knee forward, good. Go ahead. Now,
So wait, he said
don't tuck under.
go here.
Let it drop down, all right? Go ahead. Boom, you feel a stomach stretch here?
Yes.
Perfect.
And I don't feel it in my back.
Excellent, you can go back.
Thank you.
So these are the nuances. It happens just like that. But that's the retraining of the nervous system. It's like, oh, every time I do this, I feel my back, but if I just allow my body to do what it's supposed to do, everything kind of falls in the right place. And that's what the nervous system-based approach is. The body knows how to heal, but we get in the way most of the time. We try to do shit, we try to do too much shit, versus just letting the body sink in. So we have this, we have this. Now we're gonna talk about the different other planes. Frontal plane, transverse plane, because we just saw like the sagittal plane, right? So just what we're gonna do. If I take 1 foot forward like this, and I'm just gonna map up the whole entire biomechanics from the bottom up to the top here. I'm getting pronation, I'm getting internal rotation of tibia, femur, I'm getting anterior rotation here. I'm getting that upward rotation of the rib cage. But if I take this hand here and I move it like this, watch the shoulder, it starts to drop, right? And when it starts to drop, I'm lining myself on that left side. My nose, my sternum, my hip, my knee, my foot, it's all lined up. And things should feel pretty natural, or not. We'll find out what it looks like on the other side for some of you. So right here, and then we'll come back. And we'll go ahead and do the same thing again. We go through the same process, bring that foot forward. Now we go ahead and slide this arm up. Keep your head looking straight. Good. See if we can let this pelvis on the opposite side start to drop downward. Just relax it. I know it's harder than it looks. And then come back. Same thing. And reach. And let that head drop. Reach higher. More. Good. And come back. So as you reach more, you can see that the body reshapes itself a bit more, right? Now I'm going to do the other side. You're going to bring that knee forward. The foot's going to collapse. Chest up. You're going to reach opposite arm and let the other shoulder drop. You might feel like a nice little stretch in your body. And let this hip drop so then you kind of sink in. Okay? And come back. Bring the weight forward, let the foot collapse. Arm up, let the other shoulder drop. Try to relax your pelvis. If you guys are like tucking, try to chill out. And then come back. Okay. Now that is a motion I use a ton for a lot of different people. There's a lot of nuances to it. I was just working with someone yesterday with neck issue, and this is the move that we'll use to get rid of that neck issue. Why? Because when I move here, boom, boom, this all have to rearrange. Now if I do this, and I take this arm down, now I'm in my mid stance of gait. Now I'm walking, I'm running in this position. And this is how the body stacks up naturally when you're running, when you're walking. So if you're really comfortable here, but on the other side, you're like, this feels nasty. then for me, I'm like, okay, I'm expecting that when you walk, maybe after 3-4 miles, things are gonna start to come on. It might not be your foot or your hip. It could be the upper back. It could be the shoulder. It could be the neck. Something start to turn on, and I can use this and see, all right, what's going on with that? And I'm going all the way down to the foot to figure it out. Okay. So now we're gonna go into these motion and work on a hinge. So here, bring the foot forward, same thing. Reach up here like you're doing a stomach stretch. Okay, now you're gonna keep the knee where it is. You're gonna bring the hinge back. Right here. Good, good, good. And just hang out here for a bit. You'll feel the glute getting loaded. Perfect. Now you put the foot back a bit here, and now you're just gonna do small little bends. Small ones, like a couple inches. Good, good, good. And you can come back up. So it feels there, the glute getting loaded and worked right there. That's
This front leg, right?
the front leg's supposed to work. Yeah. Do you feel it somewhere else?
No, that was it. I just wanted to confirm.
Got it, got it. Because some people feel in the back leg, happens a lot. We do all this and they're like, yeah, my back leg is getting a great workout. And it's like, no, that's not the point. Most of the time it's because they're not really loading into the front leg and they're using the back leg as the crutch for support. So you just bring them closer there. This is a move I use a lot for a lot of my back pain clients. It teaches the hinge motion in the body because mechanically we can get that hinge from that pronation all the way up to over here. And we don't have to do a lot, we just do very little. So this is someone going up and down the stairs if they have trouble. If you have someone who have trouble lunging, and every time they try to lunge, they do this, you can go into here and just give them that little bit. Okay? Cool. Oh, doing great for time. All right, so let's see what else we can do here. We're gonna add a little rotation to that motion here. I'm gonna bring that knee forward. I'm gonna bring that arm up. Let this hip drop a little bit. You might need a little room for this. You're gonna take this hand and you're gonna rotate back. Back, 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 back. Good, 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 good. And come back. Okay? Very good. So just remember what we just did here. We added sagittal plane, we added frontal plane, and then we added transverse plane. Okay? Now we're gonna focus on that back leg and see what we can do about this. So if the front leg is pronating, everything is, all the chains happening that way, what's the back leg doing? It's gonna supinate. So through this supination motion, we're gonna give the exact opposite emphasis on the muscles than this other leg. So we're getting the glute to work here. We're gonna get a lot of stretch through the hip flexors on this back leg. So if you guys wanna prescribe hip flexor stretches for your clients, I've seen that a lot. But this is by far my favorite because it is actually functional to the way people move, the way people walk, okay? And I'm gonna show you guys and teach you guys how to experience that for yourself, and you guys can teach it. So the emphasis now is gonna be in the back leg. The front leg still does the same thing. It's still gonna go into that little inward motion. But now, y'all might want a little room for this, so maybe step forward a bit. Don't crowd yourself. So the back leg, here, I want you to press down through the pinky toe joint. So when you press down through the pinky toe joint, can you see that foot kind of twist? You feel that twist? That's your supination. You might even start feeling your arch muscle starting to kick on. Those guys are just starting to contract. So keep that pinky toe joint on. Now go ahead, keep that leg straight, and bring the front knee forward. But keep your chest tall though. There you go. You feel that hip flexor right there.
Keep the back knee straight.
Good. You want more of the hip flexor, you just get into the different planes of motion. So if I press down a little bit more towards my pinky toe, see how that externally rotates that back leg some more? Now I'm getting even more of a stretch in the hip flexor, right? And come back. So we hit the sagittal plane, we hit the transverse plane for the hip flexor stretch. We're gonna add a frontal plane to it. So this is the frontal plane. If I go here, I twist, I turn, this is the frontal plane. We're gonna do a hip drop. This is probably going to be a more complicated thing for all you guys to experience. Yeah. So as you let the straight leg, that hip start to drop down close to the ground, who feels an increase in that stretch there? Right?
You got it.
Perfect. Good. And come out. And now, think about your runners that need to go and run. You want that hip extension there? Do you want that push off? Now you can get them to experience that. And you want them, do you have a question there? Okay. And they can absorb the force in the front and they can push off from the back. So the supination gets them to push off, pronation gets them to absorb. You just mastered the entire gait cycle right there. Okay? Now, we do the same thing on the other side, and then we'll add the arm to it to really accentuate this stretch. So whichever side you didn't do is the other side. Here, you're gonna look straight. You're gonna press down into your pinky toe joint, and then you're gonna go ahead and bring your weight forward, but still press onto that pinky toe joint. And you should feel that twisting of your foot in the back there, and a nice stretch in that hip flexor right there. And you can feel your glutes gonna squeeze on that side, naturally. And then try to drop that side's hip. This one's tough. Okay, good. And come back. Okay, so I see you have a tough time dropping that hip over there because our front foot probably is a problem actually. So for someone to experience this well, you actually need this foot to go flat, for this foot to go arch. If this foot is like this, see how the mechanics no longer works? It's kind of fighting against each other. It's no longer that natural pattern that we're looking for. So we can add the arms to this. We do the same thing to twist here. Instead of kind of dropping the hip, we can raise our arm. So same thing, back foot, corkscrew it in, bring your weight forward, and then now we take that up. Now who feels an even bigger stretch there? Okay, now take the other arm, you're gonna twist it, whew, and go that way. Now we just add another layer of stretch there and come back. And put together, this is the move. This is the move. If I can get someone to master this move, that's their maintenance. As I said, they came in for knee pain, for back pain, for whatever it is. If I can get them doing this really well with everything looking the way it should, they're gonna be in pretty good shape. They can squat, they can lunge, they can deadlift, they can do a lot of things. But to get there, that's a journey, you see? See all these different layers that we had to get through to get to that point? We'll try a few for you guys now because we kind of got through some of those steps. So we're just gonna do a little bit faster. So we're gonna go like this. Twist in the back foot, foot's gonna go flat, and we're gonna do this. Look straight ahead though. Good, and try the other side. All right, good, cool, cool, cool. All right, that is like my favorite move, my favorite stretch. Now we're gonna do a little assessment one last time. Everyone just go ahead and touch your toes. Who feels different this time around? Yep, cool, cool, and come back up. Is the weight going towards the heel, forefoot? Who's got the heel? Good, who still got the forefoot? All right, is that you? All good, all good. All right, now we're gonna go arch back. All right, good, good, good. Anyone feel different in that one? What's the difference?
Less forefoot.
Less what?
A little bit less forefoot.
Yeah, because we just open up the stomach. We just learn how to anterior tilt this pelvis. We just learn how to pronate. So when we learn to do all these things in our body, the nervous system remembers it because it's like, yeah, it's just a much more natural move. So now it's going to adapt these motion when we start to arch backwards. Now we go, reach one hand down the side. Who feels the weight shift towards the opposite side more naturally? Good, good. Because in the beginning, a lot of you guys were going towards the same side. But now it's like, okay, when I reach down, the foot just creates some space because you just experienced the two foot shapes. Okay? Now we're gonna go ahead and rotate to one side. Go, go, go. And who feels like they can rotate a bit more? And go, go, go. There you go. So in a lot of times when we can move the foot around, get those two shapes done, rotation increases, side bend increases, forward bend, backward bend, they all start to come back because we fix the closed chain mechanics here. Now, I'm just curious for you, if you take that left foot in front now and just bring that knee forward, just hang out there for a bit. And do you still feel outside hip, just out of curiosity, or does some of the movement or load go towards the inside?
It feels more even now. I definitely feel more medialis, but I still feel it kind of around that LCL area.
Right.
Full tension.
Right, right. And come out. So LCL will be tensioned if we go out this way, because that would tension LCL. So when you get the right pattern here and it goes in, we should be slacking that LCL. So for you, it'd be very helpful for you to just be able to experience this move on a daily and just feel this. Now, this is how you can apply it for your standard exercises. Split squats, squats, hinges. How do you take all this concept and just use it like a minute from now? When someone's squatting, when someone's hinging, don't tell them to spread the floor. Tell them to feel the big toe joint. Tell them, I want you to allow your foot to go caving in. And what that's gonna do, that's gonna get into a much better hinge. So you guys can try it right now. So try letting everything kind of come in and go into a deadlift. Now come back and try to push the knees out and go into a deadlift. It's just a different sensation in the body. One is gonna load the glute a lot more than the other. And split squats, if you're doing split squats, never tell someone to push the knees out. If you allow the foot to go flat, the knee's gonna come in a little bit, and then when it come up, it's gonna arch. So the foot is gonna go flat and arch every time you do a split squat or a lunge. And you guys can experience a little bit of that for yourself right now. Just a little bit of split squats. Yeah. And what you might start to feel when you allow that foot to move, now your split squat, you will feel a lot more of the inside quad, the VMO, and a lot more glutes. Yeah, especially you, that was good. See how everything just kind of came in a lot more over there? A lot less stressful going on to your outside. Of course, left and right, same deal here. So split squats, you can correct it through there. Your hinges, you can correct it through here. Squat, same thing. If someone needs to come in a little bit for the squat, it's okay. I don't need them to go all the way out. If you want to squat a massive amount of weight, go wide and do it, if that's what you're looking for. But if your client's just looking to be functional and just want to feel good in the life, maybe just allow that little bit of that in. It's okay. I say just don't let it look ugly. Just for your reputation, don't be letting people see you like your clients do shit like that. But like if they're like kind of like here, it's perfectly normal. Perfectly normal to have a little bit of that inside. Okay? Cool, we have 5 minutes. So that is kind of the introduction to what I do. One of the main things that we do is actually looking a lot into foot mechanics, closed chain mechanics. And we actually have a workshop January 27, 28. No, this is different. This is different. This is different.
Okay.
We have a presenter coming. I'm not presenting on this topic. So we have a presenter coming in, and he's talking about everything I talk about today in relation to the foot. But he's bringing on these wedges, which you can manipulate here, here, and here in the foot. That changes the kinematics of how the rest of the body aligns. And he's applying that for strengthening, and conditioning, and performance. So if you have a client who's looking to lift a lot of weight, instead of coaching all this through, you can slip these little wedges here and here, and then it will automatically get through those ranges of motion for you and fix the foot and the whole chain. Pretty cool workshop that we have going on. This guy, he's from Santa Cruz. He's only one of 7 people that can actually present on this type of topic. It's a bit of a nuanced type of learning. So if you guys are interested, I'd love to send an invite to all of you guys and check it out. Okay. Otherwise, that is pretty much it. Does anyone have any questions?
What's your TikTok or Instagram?
Oh shit! All right. I'll send it over to everyone. It's Dr. Gia Lee. So Dr. Jiali. Naturally, I bought some cards. Shit. I never bring cards, but I got them today.
I have PDMs with like right? So there's some people like gave your Instagram.
Oh, okay.
To their
Yeah, follow me on Instagram.
hour long PDMs.
I'm really bad at getting followers, so I literally just go to each person like you and tell you guys to follow me.
You're like Dr. J.
Yeah, Dr. Gia Lee. We'll send it over. So this is our card. We're out in Needham, and we do have a partnership with Equinox Chestnut Hill, and we want to extend this invitation to a lot of other people as well. So, okay, yes. God, we got a few more.
If you look up Dr. J. Lee, Jiali,
Got a question?
I also
All right, cool. We got questions. We got questions.
you make like clever posts, so
Oh, okay.
hopefully you're still doing.
I'm still doing some stuff.
And his blog is really good stuff.
Thank you. Thank you.
When is that back for Senator?
I have to read for
So that's in January 27th to 28th. And we have a couple other cool people coming by. We just secured I don't want to speak too soon, I won't say it. You have a question?
When you mentioned like Rebecca earlier, was that Rebecca Patton?
No. Who's Rebecca Pan?
I don't know, I feel like she did like physical therapy.
No, it's she's not in the field. She's our administrative staff, our clinic organizer. Okay. Question?
So, if you could go back in time, would you still go to PT school?
Oh, what kind of question is that? I'll go back in time. Knowing, it's hard to answer because if I go back in time knowing that I'll be where I am today, I will absolutely do it. Because I think we're fulfilling a gap and we're completing a mission of helping these people who's kind of been left behind. And without my degree, I can't do this. So in a way, yes. But if I don't know I'll be doing this and I will be working in an insurance-based clinic like everyone else, I would not. Question?
My question is about one of the movements. So I have my lower back pain and my left hip kind of like catches when I go into like not like a flexion. So on the first thing we did, where we kind of like pulled it forward, I felt that in my left hip. Like it felt good on my back.
Yeah.
Should I
I don't really know. So it's hard to answer that question because I really need to understand like how things are actually moving. I need to look at you. So if you don't actually have access to this full motion here, that's going to trigger how everything is going to work up the chain, right? So if I see that this foot is really stuck, is not moving well, I think if I give you some good motion here, that might free up the motion up in the hip. But I won't know that until, so what I would do, like just like a broad catch-all, roll out your foot, massage it out, try to experience this shape a bit more, try it again. If that gives you a different experience, then you're doing really good and you just reinforce that pattern until it just becomes your new normal. Yeah. Yeah. But like I said, we have a relationship with Equinox, so especially in Chestnut Hill, we do a lot of free sessions for trainers. We have a collective program in which like you send us some clients and we work together. We keep them, I mean, if you send us a client, we keep them pretty much working out with you so they don't have to leave. One of the most frustrating things for me as a trainer back then is like I'll send a client to a PT and I'm just never seeing them again. I was like, what just happened? They were dealing with this small thing and then now they're like in PT forever. So we don't like doing that. So you send us over here, we just give you the modifications. Like for example, like squatting, I want this guy to do this when they squat. I want their hinge to only go back here. I want the split squat to only go quarter way. So we'll give you the modifications, you can take care of the rest from there, and we'll take care of the rest. So it's very much of a collaboration. And that's something I would have liked when I was a personal trainer. So when we take clients from trainers, that's exactly what we try to do. And the perks are free sessions with us for you personally, and also free merch, and also a free massage from our partners. Yeah. So If you guys are interested, I'll be happy to send you guys the information so you guys can learn more and be a part of it. All right? It's okay if I just grab some emails from the team? Perfect. All right, well, thank you guys so much for being here and listening to me yap around for like the whole hour. Hope you guys got something out of this and have some stuff you guys can apply and excited to apply for your clients. All right.
Thank you.